Hello, welcome to the ESC TV in the Amsterdam Congress of the European Society of Cardiology 2023. Today we are going to be talking about the Resilience Project. I am Borja Ibañez, I'm a cardiologist from Madrid, Spain, and I have the privilege of having here two of my colleagues, experts in the field of cardio-oncology, Teresa López from Madrid, Spain, who was a chairperson for the 2022 ESC Cardio-oncology Guidelines, and Riccardo Asteggiano from Turin, Italy, who is the past president of the Council for Cardio-oncology. So first, let me introduce you what is the Resilience Project, which is a European Union-funded Horizon 2020 project that revolves around a randomized clinical trial. There are other activities, but the main activity is a randomized clinical trial where patients who will start chemotherapy, including anthracyclines, and who are at high risk for developing cardiotoxicity, are being randomized to remote ischemic conditioning, a therapy that has been shown in experimental models to reduce the prevalence of cardiotoxicity, or SAM. Patients undergo several magnetic resonance imaging studies, and the aim of this study is to identify whether this intervention can reduce the prevalence of cardiotoxicity. Among the different partners for this project, which is coordinated from the Spanish National Center for Cardiovascular Research, the European Sociedad of Cardiology participates as partner. Also, we have a coalition of patients, we have the participation of industry, Philips in this case, and we have participation of different centers in 7 European countries. So first of all, let me ask Teresa, which was the reason for the European Society of Cardiology to get interested in participating in this study?
Thank you for the question. I think that is quite easy to answer this question because, as you know, cancer and cardiovascular diseases are the two main causes of death in Europe. And the problem is that patients with cardiovascular diseases are at high risk of developing cancer, but in the opposite, patients with cancer who are treated with a cardiotoxic drug can develop acute cardiovascular diseases and also long-term cardiovascular problems. So we really need to learn how to manage both entities at the same time to improve patients' outcome. So the ESC Society is really interested in promoting this growing field of cardio-oncology and to help professionals to optimize the clinical pathways to take care of these patients with cancer and cardiovascular diseases.
So within this project we have the collaboration of oncologists, hematologists and also cardiologists. So how is this interaction fitting within the ESC projects?
Well, as you mentioned, the ESC published the first ESC guidelines on cardio-oncology last year, and this is a collaborative project with European oncology societies and also with the International Cardio-Oncology Society, because cardio-oncology is a multidisciplinary teamwork. We cannot work in our clinic separate for the interaction with oncologists and hematologists. And particularly referring to the Resilience trial, the work with hematologists is really important because we know that for many years that anthracyclines can induce cardiovascular problems, heart failure mainly, but even this is well known for many years. The mechanism that lead to this cardiovascular toxicity are not really well described in the literature, and we really need, and this is one of the gaps that guidelines highlight, we really need more information, more data on the mechanism of anthracycline-induced cardiovascular toxicity to implement preventive strategies.
Thank you very much for explanation. So in fact, both of you are co-principal investigators from the ESC for this project, but it's very important that we can explain to the audience what are the main activities led by the ESC within the Resilience project. Riccardo.
Well, first of all, let's explain that the participation of the ESC in this project touches all the main points of the strategic plan of the ESC. Advocacy, for example, because the involvement of the ESC in this project enhances the visibility of cardio-oncology in all the medical environment, not only cardiologists but also cancer specialists, and in patient organization, in policy and so on. For sure, the research pillar of the strategic plan, because this is a very important research project, probably the greatest project in cardio-oncology ever done, involving a lot of patients. So research on this field where the ESC is collaborating is very important for the ESC. Other aspects are the social involvement of the ESC due to the collaboration of a lot of stakeholders in this project, not only from the point of view of the medical professional, but also from the industries and essentially for the patient. This is one of the first important projects, research project involving actively the participation of patients. The last aspect is to contribute to the education of cardiologists and cancer specialists on this very difficult management of the patients with possible toxicity due to anthracycline. So I think that this is the role of the ESC and is probably very important that ESC is involved in this.
In fact, it's touching many different aspects, so it's very good the participation of the ESC. Yeah. So Teresa, the project started in 2021, but can you explain a little bit what is the status of the project? How is the project evolving, the trial?
Yeah, so the receiving is designed to include 600 patients in 5 countries. We have already randomized at least 90 patients. And the idea really is to be able to get a deep phenotyping what is happening during and after cancer therapy. In this case, the recipient is focused on hematological patients that receive anthracycline. You have provided basic research on the role of ischemic preconditioning as a preventive strategy to anthracycline-induced cardiotoxicity, and now it's time to really test how this strategy works in patients and to understand how it promotes mitophagy. And for that proposed CMR is a really interesting tool because we are able to obtain very high quality and precise imaging of what is happening nearly at a molecular level to understand what could be the precise mechanism and what could be the precise strategy to prevent this anthracycline related cardiotoxicity.
So 90 patients is already a very good number because this is a complex trial. Patients undergo this remote conditioning, which is similar to blood pressure cuff, but they bring the device at home and they have to do this at home for once a week for the entire period of treatment. So it's very nice, as you say, that we are able to perform magnetic resonance imaging to be able to characterize what is happening in the myocardium besides the classical ejection fraction and strain parameters.
And one important advance of the resilience is that you are testing a new CMR sequence that facilitates the implementation of CMR into clinical practice. And this is also very important to be able to reduce the scan time and to get the same amazing data that when we have a large study.
Yes, this is part of the collaboration with Philips that they have developed in collaboration with the CNIC this sequence that is very well suited for these vulnerable patients which cannot tolerate these very long studies.
Exactly.
And ideally they can have this scan in less than 1 minute.
Exactly.
So many things that are being tested within this trial.
Definitely.
Ricardo, also one of the activities of this project is to organize some sort of congresses which gather together different stakeholders. So can you please explain a little bit what is this about?
As I said before, the involvement of all the stakeholders of the project is one essential point, and is probably the first time that all these components are joined together. And one first moment of aggregation of the stakeholders is a congress, a meeting in Nice at the Heart House in October, that will be held in October, where are invited cancer specialists, cardiologists, nurses, allied professionals, and the industry's representatives, and most importantly, patient representatives, patient from the patient forum, but also patient involved in the study. And we will have experiences, an exchange experience during this day, and we will go in depth on some aspects of prevention and management of cardiac toxicity by anthracycline. And I hope that this will be the opening of a door on a universe. We need to be open to patients for the future and collaborate with them.
Very nice. In fact, Teresa, your guideline, the 2022 Cardio Oncology Guideline, was one of the first ones which had in parallel guidelines for patients, done by patients in collaboration with you. So how simple and how important is to incorporate patients into trials, clinical guidelines? And
yeah, this is a really important strategy on the top of the strategies that we really need to promote at the ESC, because we really need to understand what the patients feel when they suffer cancer and cardiovascular diseases, and how we can help them to improve their own cardiovascular care. Because if we are not able to involve patients in their own cardiovascular care, it's impossible. We lose the battle. So we need to, of course, increase our knowledge on preventive strategies, but we also need to promote a healthy lifestyle. And we need to engage patients in this healthy lifestyle during cancer treatment and after cancer treatment. Yeah, so it's very, very important. In fact, the ESC guidelines for patients are focused on these preventive strategies to minimize the risk of cardiovascular diseases after cancer therapy.
Very good. So I think we have more or less explained what is resilience about and this update that we are doing in the ESC. So I don't know whether it's something that you would like to remark as a conclusion before we can close this ESC interview. Anything that you would like to highlight?
Perfect.
Well, I want to invite the people who is interested in cardio oncology to join us at the ESC Council of Cardio Oncology, because I think that we really need to grow our ESC community to be more strong and to be able to increase data and research projects like resilience to grow the cardio oncology field.
Perfect. So you are all invited to join this endeavor. Thank you very much. It has been a pleasure, and hopefully we'll see next year updating on the status of resilience.